Hi, my name is Dr. Ed Sykes and I work at the Science Media Centre. I'm here today to talk to you about medical news and how it gets into the media. Now the first thing I want to say is that we obviously have a very mixed bag when it comes to media. I'm sure you're all aware of many times when there have been problems, when you get stories in the news that really shouldn't be there. They're overhyped, they're over-egged, that often have no foundation to them at all. But the problem is that it's really quite complicated. There's a whole case of where you might find problems with the stories, but there's also examples of good journalism where the science is reported accurately and where it's reported in a way that the scientists are happy with. So I'm going to take you through how this happens and discuss ways in which we can actually try and improve on this. So the organisation that I work for, the Science Media Centre, is a very, very small organisation. There's only 7 of us that work there at the moment, and I'm going to tell you a little bit about our history and how we operate so that you can get a good understanding of how we work with the media and how we can come to talk about the way in which medical news comes about. Before I go any further, I should talk about the way that we're funded. So because we are a totally independent press office, we get our money from about 80 different organisations, and none of them are allowed to give us more than 5% of our running costs. Our independence is so important to us that we have to make sure that the journalists and everyone that we work with completely understand where we get our money from and that no one can have any undue influence on us. So by capping that money at 5%, it means that even if a scientist says something bad about one particular organisation or their products or anything like that, then they won't withdraw the money, or if they do, then it's not really a big problem for us. We get that money from medical research charities, from government money, from universities, from media groups, from a whole range of organisations. Basically anyone that thinks that we do a good job and buys into what we're doing, but they don't actually get any benefit for that. So, where we come from. The Science Media Centre itself was set up back in April 2002, following on from debacles in the press such as MMR, BSE, GM crops. It was a time when public opinion was being swayed by the articles that they were seeing in the news, the programmes they were seeing on TV, and the way in which they were being reported meant that the public were being misinformed and were running away with ideas that weren't based on science. And that's a problem. So the House of Lords Select Committee kind of got together and said, what are the things that we can do to actually try and improve the way in which the public get to hear about the science? And they came up with a whole raft of decisions, a whole load of suggestions that they thought might be able to help, and one of those was to have an independent press office, and we kind of came about from that. Now, what was discovered back then when these stories were coming out was that if you don't engage with the media as an expert yourself, someone else inevitably will. Because the journalists are under such time pressures. They have to file so many stories in a day, they have to get their interviews done, they have to file their stories sometimes by 2, 3 o'clock in the afternoon. They have to get hold of someone as quickly as they possibly can. And if the right expert, who's at the very top and knows everything about the science, isn't available, doesn't answer the phone, then they'll go to the next person down. And if they don't answer it, then the next person down, and the next person down. Until very soon you get someone who doesn't have much expertise at all, but is simply quite happy to stand up in front of the camera. Now, 90% of the public get their information about science from the news. So of course this is a big problem. And our entire philosophy at the Science Media Centre is that we'll get the media to do science better when we get scientists to do the media better. Now there are 3 main ways in which we work. We work with rapid reactions, we work with roundups, and we work with media briefings. And I'm going to go through each of those and explain how they work and why it is that they're useful for the journalists. But core to all of that is a database of scientists that we work with. There are about 3,000 scientists and about 900 press officers from organisations all across the UK. Every single person on the database has agreed to be on there. They're quite happy for us to give them a call no matter what day it is, what time it is, and they're willing to talk to us and say, tell us a bit more about the story that we're ringing about, whether or not they're the right person. And they're not saying that they're definitely going to do this interview or they're going to help us, but they're not going to be annoyed with us if we do give them a call and give them a try. And quite often they can point us in the direction of someone else who might be able to help out. So, the different ways in which we work with the media. Roundups and rapid reactions. A rapid reaction is when we react to the story as it's breaking. Example from just today was a story of stem cells in the news where we woke up to a programme woke up to the Today programme and heard the story on there about scientists up in Glasgow using stem cells therapy to treat stroke patients or a new trial that's just starting. So the first thing we do is we get alerted to this, we call up some scientists on the database, we send them emails and say, are you happy to get involved? Can you send us some comments, anything you can issue that we can then send out to the media? So another example was back in 2009 in April we had swine flu, and of course there was a huge big story, and despite the fact that many people feel with hindsight that it was hyped or over-egged in some ways, at the time the scientists were very concerned about what was happening. They were hearing about deaths in Mexico, they were getting headlines such as UK swine flu alert, swine flu death spark worldwide health alert, and killer flu it is here. And we spoke with over 100 scientists on swine flu during the months that this was a big story, and they were issuing comments which we could send straight out to the journalists, and they would give them information about swine flu, what we knew at the time and what we didn't know. We issued fact sheets that were signed off by the scientists, and that gave the journalists more information, because no one had heard of swine flu. They might have an idea what flu was, but how did it differ from seasonal flu or from avian flu? What should we be scared about? Should we be doing this or that? So we were trying to get that information out to the journalists as fast as we possibly could. These are just an example of the inquiries that we got over the first few days. And it's important that I point out here that we only work with the UK national news journalists, and so that's represented by the people that gave us a call. Now, the questions were coming in so thick and fast from the journalists, who are under such pressure nowadays that not only do they have to fill their newspapers, they've also got to fill their online media. So they have to have interviews, they have to have video, they have to have audio, they have to have Q&As, and they have to get that information in so quickly. They're under extreme pressure. So we were getting questions in from the journalists, sending them straight off to the scientists and getting the answers back. And we end up with for example, on Channel 4 News, they did a news piece whereby they've got the package in the actual news, and then they go on to online and deal with more questions after and have much more time for it. So the issue with science in the UK and the way it's reported is not that there's not enough science in the news, because there's loads of it. It's about the way it's reported, and that when it's in the hands of the specialists, it's reported really well, and we're trying to help feed those specialists with the information they need. It's when it gets to the general news reporters who perhaps don't have as good an understanding of science and the way science works that you can tend to get problems. I'm now going to give an example of when we had a little bit more time to actually work on the story. So this is the case when we get a roundup. When we work with journals such as the BMJ, the Lancet, Nature, so on, they send us their embargoed press releases at the same time or even before when they send them to the journalists. We can have a look through and see what they're going to be discussing, and then if we think it's necessary, we can send that on to scientists and get them to give us some feedback. So for example, this particular paper was about the effect of moisturising creams when given to mice, and there was a risk of cancer as a result. Now you can imagine that some of the papers may want to go quite wild with this research. So we got some comments saying things such as, this is an artificial situation, the differences between the creams are pretty small, still a lot of controversy, studies of mouse skin cancer have contributed little to us understanding of human skin cancer, that type of thing. And as a result, you end up with headlines like this in the Mail: skin cancer linked to moisturiser, but only in mice. Some great coverage, lots of all the scientists' quotes are included in there, and they really give the context and the caveats that make the science understood. But going even better than that, rather than just responding to what's happening, rather than being informed of the stories that are about to come up, we can also set the agenda, and scientists can do this by doing press briefings. When I first started at the SMC, we only ran maybe 50 a year or so, and that number has just rocketed over the last 2 years. And we now run about 90 of these a year, and they all run along the same format, and it's a great opportunity for the scientists to set out the agenda and to really control what goes on. Now, it's really difficult to get a journalist to come along to a briefing. They're so time limited, they're under such pressure that you really have to make things easy for them. Unfortunately, that means pretty much limiting it to London if you're in the UK, because they just can't travel too far from their desks. So what we do is we persuade them to come into where we work in the centre of London. We always have it nice and early, 10:30 on Monday, Tuesday, Wednesday morning if we possibly can, so it's not competing with stories that always come out later on in the week from the big journals. we ensure they've got top experts they can speak to, and we don't spin it in any way. They get to ask the experts the questions and listen to the answers without any kind of barrier in between. So, to give you an example, it's a picture of how the briefing was actually set up. Just a few panellists sat on the front, a small number of journalists in the room. And this one example I'm going to talk about was the health of nuclear power station workers. Now, this was a story that was potentially could have been really massive and could have been a scare story as well as a scary story. It was all about some research that had been done on workers in nuclear power stations and looking at levels of heart disease. And it was a huge study. I think it involved something like 28,000 workers, big numbers like that. And the researchers themselves were statisticians who didn't necessarily have any media experience. And so they were concerned that there was going to be huge headlines that came out as a result of this, and lots of the journalists knew the results were impending. So what we did was we spoke to the scientists and we sat them down and we gave them some training. We talked through how they could actually do this, how they could get the information out in the best possible way, types of questions the journalists would ask, the numbers that they'd been needing to show, and how to actually get that across in a way they'd understand that would explain the context and the caveats and get the full story out there. So we sent out an invitation, just very simple. It says where, when and what it's going to be, who's going to be there. These are the journalists that attended. A big long list because they knew this could be a big one. And we also got some independent comments from some other scientists who hadn't worked on it but had seen the paper, and just as we do with our roundups, were able to give comments and extra context for the journalists. As it turned out, once all the caveats had been explained, the journalists didn't think it was that big a story after all and kind of left saying, you know what, it really wasn't that big. So we ended up with some nice piece in the Telegraph and the Independent and the Times saying how nuclear workers were more at risk, but that actually it was better to be working in a nuclear power station than not working at all because of the benefits of socio-economic and lifestyle factors. Now, scientists can even go one further and can actually really get messages that they want to push out into the media if they approach and control it in the right way. So, for example, we were told by some scientists they were worried that EU legislation might be threatening the research they were able to do because it was over-regulating the use of animals in research, and as a result they wouldn't be able to do important medical research they were trying to achieve. Now, a few years ago there'd have been horrible headlines all about cruelty to animals. There would have been lots of activists being talked about, but the climate has changed now and scientists are much more able to get their views across to actually explain and have a rational debate about why the research is being done. So here's an example of some speakers that came along to the briefing, and here's the journalists that turned up. And as a result, because they sat there for an hour talking to the journalists, talking them through what they were doing, why they wanted to discuss this, and why they were saying, we're not saying get rid of regulation, but we're talking about ways to improve it so that everyone can benefit. We end up with headlines such as animal test restrictions threaten vital research, potential cure for Alzheimer's and cancer threatened by EU red tape, and new animal research rules will disrupt medical progress. So really, really good headlines for scientists that you wouldn't have had just a few years ago. Now, I also want to impress upon you just how much the journalists, the specialist journalists, are wanting to get right the information they're putting out there. They care about the stories that they write, and they care about the way that the scientists view them, because they have to go back to the scientific community time after time after time to get those stories in the future. A general news reporter doesn't have that kind of link and doesn't rely on them. They're on one story over here and then another story, something else the next day. Whereas with the scientific and the health and the environment specialists, they end up knowing these scientists, they go back to them time after time, and they understand the scientific process and how it works. But quite often they're also fighting a battle that we don't necessarily see. For example, an editor might see a press release for some amazing piece of research or a claim that lands on their desk. They receive hundreds every single day, and they say to the journalist, look, we want you to write the story, go out there and find me someone and write it up. And the journalist knows that it's a pretty rubbish story, so they actually come to us and say, look, can you please find someone who can give me a quote so either I don't have to run the story or that I can run it in a more accurate way. Because if the journalists themselves won't agree to run it and won't write the story, then quite often the editor may just pass it on to someone else, and then you end up with a much worse result. So this example here was a rapid reaction to the story that eating watercress prevents cancer. It was a press release that was issued, and we got some scientists to comment on it, and they said things such as Watercress has some good properties, but you'd have to eat huge amounts of it, and there's nothing particularly special about watercress over other foods. And you end up with great coverage that says, good news, watercress can cut risk of cancer, bad news, you need to eat a bagful every day. And you may turn green in the result, I believe they said. Watercress being a lacy food, it gets the scientific comments out there, and they get their caveats into the story, which otherwise you wouldn't have had. Now the journalists, to give another example of just how much they want to get the story right, we've had journalists approach us and say, the science is tough, we perhaps come from a different background, we're now on this beat and we need some help understanding how the process works, understanding how to read a paper and so on. We actually had a 2.5-hour tutorial with a number of journalists who came along, and they listened to a top epidemiologist talking about how to read through a paper, how to go through a press release and see whether what the press release says is backed up by the paper, to see whether what's said in the summary of the paper is backed up by the stats and by the data that's inside it. And this has turned out to be a really big success. We've been asked to do successive ones as a result. It's not just the journalists that we're there to help, of course. We're there to help the scientists, and we encourage scientists to get involved. 3 times a year we run events called Introduction to News Media, where we get scientists along who perhaps don't see the point in getting involved with the media, have been burnt before, or really don't quite understand how it works and curious to know a bit more. And we give them an opportunity to talk to some journalists, to understand about their day and the time pressures they're under and what their work involves, and to also hear from some other scientists that have done the types of interviews before. And this really gives them an understanding of what's involved, and maybe doesn't mean that they'll end up wanting to do interviews themselves, but they may understand when their colleagues want to, or try and help us and point us in the right direction of other people that will. We also offer leaflets for scientists that they can have when they're about to do an interview on top tips for media work, or conveying issues about uncertainty or risk, or when working with animal research. And we're finding this all proving to be a really big success, and actually now the Science Media Centre is spreading to other countries. They're not linked to us other than they're modelled on us, and we know of them and we work with them. They're now in Australia and New Zealand and Japan, and perhaps there might even be more coming up in the future. So thank you very much.